My main strategy would be to make it so that if our cameras cut out, Jimmy, I would be able to have you know exactly what I expected of you without having to see me, right? I appreciate being able to read your expression and see your body language. That's huge. But I would expect of myself that I could give you clear enough instructions verbally that you could follow them.
All right, welcome to the show. From the gymnastics floor to the Pilates studio, Rachel Peters has spent over 2 decades mastering the art of movement and recovery, a Columbia-trained physical therapist with a flair for blending science with the fluidity of dance. She's here to share how she's revolutionizing patient care in her own way with virtual therapy. Rachel, welcome. Thanks for coming. Thanks for sharing with us. Thanks for being you.
Oh gosh, thank you for having me. I'm honored to be on the program.
So you're a physical therapist. Give people the background. Where do you practice? What's the name of the place? Always good to name drop. Share the 411 on Rachel.
Okay, on Rachel. Well, I am a physical therapist in the San Francisco Bay Area. I'm currently residing in Redwood City, California, which is about halfway between San Francisco and San Jose, about 5 miles from Stanford University, my alma mater for undergrad. So I'm fortunate to be able to be back in the area where I kind of started.
Yeah.
Yeah,
And
it's
then
great.
walk us through a little bit. Like, tell us about the clinic. You know, who do you get to help and treat in the community? Like, sort of paint us a picture, since saying you're a PT just is a wide spectrum, right? Like, help us understand like who you get to help and what your clinic looks like and feels like.
Sure. Sure. So I run a small clinic in Menlo Park, California, which is just a stone's throw from Stanford University. I work for a larger company called Agile Physical Therapy. We have clinics from San Francisco down to Palo Alto, a little satellite in Los Altos. So Bay Area Peninsula. We have a larger company that has branches in the East Bay and all sorts of different places. And our whole mission, vision, values, I've been with the company for 15 years now. I take to heart too, is we just want to make our communities healthier and keep our communities healthier. So we try to embody that at our site, which has there's 3 of us clinicians and a wonderful care coordinator, and we want to keep active people active, get people who want to get moving in a way that's healthy and productive for them, and just helps them meet their goals, whether it's you're a gymnast, your soccer player, your weekend warrior, person pushing a big birthday like I am,
Yeah.
or our aging community members who want to stay active.
Okay. Well, one of those ways is something that feels like it came on us real quick a couple of years ago. And a new report from Peterson Health Technology Institute came out talking about the analysis. This is a third-party organization, did an analysis on virtual musculoskeletal conditions. And it sort of did this really great, I like to call it a high-level analysis of different types of virtual MSK solutions, and then sort of ranked it on clinical effectiveness, economic impact, and then sort of gave it like an overall grade, essentially saying like, hey, is there a future in this? Does it do what it says it does? Is it effective? Is the juice worth the squeeze, as I say? And they overall, again, this wasn't done by the APTA. This was done by a third party. They said, yeah, like this is really, it's good from what we can see so far. As most researchers do, they say more research is needed. Always good to keep the job security, right? More worth looking into, though. And when we heard of that, and we saw APTA do a webinar and a live stream with the people from Peterson Health Technology Institute, we said, let's get a little more granular. So we bring you in because you're someone who's doing some of these virtual MSK care solutions. So these things can be delivered in many different ways, but I wanted to get your insights for real clinicians thinking about implementing them, or maybe implementing them on a larger scale. So as a seasoned physical therapist, we mentioned with more than 2 decades of experience, how have you seen the role of virtual care evolve in the field of physical therapy from your point of view?
Yeah, well, that's an interesting question. I think that it's evolved from being literally a nothing. I mean, when I was in college, there was no virtual
Right.
anything, right? The internet was was still kind of, I'm aging myself here, dating myself here. The internet was kind of, it was just starting to kind of uh, explode. a little bit. I think that it's evolved quite a bit. I mean, I think it's evolved out of the almost, in my opinion, kind of the dinner party conversation of, hey, oh, you're a PT. I hurt my shoulder. You know, the kind of stuff that we all hear.
Right.
Do you have time for a conversation on the phone about this? Do you have time for a text conversation about this? And I think the pandemic was really that tipping point, right? Where we realized we have these platforms like Zoom or even, FaceTime, when that became HIPAA compliant and all of that for that brief period during the throes of COVID. Um, it seemed to be kind of an organic evolution.
Necessity is the mother of invention. I remember sitting in Denver, Colorado, for those people who were at CSM in 2020, just a month before, things really changed, as they say, before stuff happened. And, virtual care was nice, but we're 5 to 10 years away from ever being able to do that. And then, of course, necessity being the mother of invention said, we're going to hand this to you now and you're going to be able to do it. Let's talk about challenges and opportunities, just two different sides to the same coin, really. Talk about some of the biggest challenges and opportunities in adapting your practice to also include virtual care. So it's not just maybe a friend from college doing some FaceTime with you, but especially when working with people that you do. So let's talk opportunities and challenges. What have you seen?
Well, I think again, like you said, it's two sides of the same coin for sure. I think getting buy-in that we don't have to have our hands on somebody to give them good, solid clinical help, and a good, solid rationale for how, how somebody can really be their own advocate beyond, seeking out care, but just how they really how we can help patients be their kind of the driver of their destiny in terms of how they want to recover from
Yeah,
something. And I think that I think it's actually an opportunity more than a challenge. I think that being able to have that conversation. I think what we bring to people. I forget who said this. What we can offer people is right between our ears, right?
yeah,
More so than any specific technique that we can
sure.
impart on them or do to them. Um, so I think gosh, especially with the post-op oncology patients, I think people are so that patient population, which is kind of a near and dear to my heart, especially the postoperative people who've undergone treatment for breast cancer. That's kind of an area of focus of myself. Um, there's so much being done to people in this situation that I think I think that what I offer them is an opportunity to take what I'm telling them and
Oof.
and integrate it and see it almost in real time, that you
Yeah,
can you can move differently just by hearing me tell you how to move move differently, or
yeah,
giving you a suggestion to kind of tell me your experience
yeah.
and show me your experience, and I can say, hey, well, what about this? I don't have to put my hands on you, and what about this?
Very
Does that make
powerful how you
sense?
said that. Very powerful how you said that. There's so much being done to this particular patient population and others. This is something they can do for themselves without having to maybe take time out of their day. Maybe they can reach you when they really need to instead of having to wait. Even a week is sometimes a long time. Didn't plan on this, but the morning that we actually set to record this, I got a message from someone from college that I haven't talked to in 20 years. Now I'm dating myself, but hey, saw a live stream that you had done, hurt my wrist. What are your thoughts? And I was able to quickly just Zoom and offer my 2 cents. But I think right now clinicians, my 2 cents, the general public is mostly okay with this. They're open to it, I should say. So
Mhm.
let's talk about more strategic things. What
Sure.
strategies do you employ to ensure patient engagement and adherence to treatment plans in a virtual setting? It's not the same. It's similar, but different. So, hey, not everything's going to transfer over exactly. So, what are some things that you've used or learned in terms of strategy?
Okay. In terms of during an in-person, or excuse me, a live session over
Yeah,
virtual.
yeah. Either those differences that we talked about being these are similar but not the same. So, what are
Mhm.
some things that you now have to sort of adapt yourself into how you say things, how you do things in terms of virtual care?
I think that strategy wise is just choosing my words really carefully. Um, I think that my main strategy would be to make it so that if our cameras cut out, Jimmy, I would be able to have you know exactly what I expected of you without having to see me, right?
Yeah,
I appreciate being able to read your expression and see your body language. That's huge.
Big.
But I would expect of myself that I could give you clear enough instructions
Yeah.
verbally that you could follow them.
Yeah. I could see communications being a challenge, but it is one of those things where, like, I bet you if you were doing it for a couple weeks, couple months, you're gonna say, "Wow, my communication skill has has benefited from this." And it's not and those skills are transferable not just with virtual care. Is this a challenge? This is different. And when you work that muscle, that communication skill, it gets better all around. Let's get real specific. HIPAA
Sure.
compliant, of course. Is there a specific case where virtual care played a pivotal role in a patient's recovery with you that you could talk about and just highlight how you could how the virtual aspect came in to really be a value add?
Absolutely. I'll give you one for sure, and I'll give you a second
All right.
if we get to there. So during the early throes of COVID, I have a close friend from college. She was a local PNR physician, and he was not always local enough to be able to get his patient population to come drive to my clinic or seek me out in person. But during the pandemic, I was able to um, work with a few of his clients who happen to be gymnasts, which again is a particular interest of mine. And I spoke with and worked with a young woman who was getting ready for some semblance of competition season. We didn't know how long the lockdown was going to last, how long their practices were going to be canceled. Um, the benefit of the virtual session was really interesting because it was not something any of us were crazy familiar. Yeah, we were just getting our feet wet with all of this. We turned her room into her gym. Said, hey, let's pull the camera out. Let's set you. Oh, you've got bunk beds. Oh, you've got a ladder. Okay, what do we need to work on? And we were able to. I was able to help her tailor a specific program using what she had in her home to get her where she needed to be.
That's
And
powerful.
it really was. It was really, and I think it was eye opening to her and to her parents. As a teenager, we needed buy in from mom and dad as well, and having them realize that yeah, we can do this. We don't have to meet outside your house and go to your lawn to do any of
Yeah.
this stuff 6 feet away. I could help you 15 miles away.
Yeah. That's
And
great. What's the second example? I'm never gonna say no to another
Oh,
example.
okay. No, the second example was a wellness client who just traveled a ton, but happened to have a lot of resources at his disposal. He had some Pilates equipment at his house and had, prior to COVID, been working with somebody one-on-one in person at his home, and we were able to adapt his um, Pilates regimen to, not only get him back to a maintenance level of Pilates that he had been working one on one with someone in person for a while, recovering from an injury. We were able to progress his program and have him trying things he had not tried before, in the comfort of his own home with someone guiding him, at times that were convenient for him because he was,
Sure.
had other obligations. And I think it's really powerful to be able to see it not just be a luxury for somebody to have. You could have someone in your home
Yeah.
without having them actually, being in your home at a time that was convenient and worked out for everybody. So
That's great. I love those two examples right there. Let's ask you to boldly look into the future here.
sure.
Right, just from your insight. We won't hold you to this. But looking
Okay.
ahead, how do you think you envision the future of virtual physical therapy progressing, growing, evolving? Is specialized in some specific areas like post-operative oncology care, like you mentioned, specific patients. I think we can learn a lot from the specifics to generalize. But what do you think the future's going to see with this?
Okay. I think it's here to stay, first of all, because I know that was a
Right.
big question
Sure.
initially. How long is this gonna happen? I have the luxury of working for a private clinic where we have commercial, insurances that actually will cover a lot of these services, but also as an out of network, clinic, we see in business, we see a lot of people who want to pay out of their own pocket for this. And the fact that it's here to stay is huge. I
Yeah.
see it continuing to be really popular with people who are busy and are traveling and want to be able to keep up and keep accountable with us, and not just accountable for a maintenance perspective, but accountable in a way that will allow them to continue to progress. So I do see this probably becoming more popular and more mainstream
Yeah.
in situations where maybe it wouldn't have been a go-to before. I see this becoming a skill set. I would love to see this moving forward becoming a skill set that's important during PT school.
Sure.
Um,
I think those in academics are recognizing this, and my guess is I can almost hear the scribble of pens of a syllabus being edited and added to. But I think you're right.
yeah.
Love sharing that. We have something here at APTA Orthopedics we call WOW, words of wisdom. What's something you'd want to leave with the audience? Maybe like an idea or a sentiment that you'd want to leave with the audience.
Okay. Don't leave anything on the table. If you think that if there's something you're interested in trying, even if your instinct is to say, I don't know that I'd be good at this, leave that by the wayside. Try it. Try it all.
Love that.
This is here to
Love it.
stay.
Rachel Peters, thanks for doing what you do in your community. Glad to see this virtual care that was done by this third-party organization. Glad to see the tactics that are put into play after we saw the positive reviews on virtual MSK care from Peterson. So thanks so much.
Awesome. Thank you so much for having me. It was a pleasure.